Hi everyone, my name is Anna, and I would like to introduce you to my research on analyzing the policy sphere behind One Health in Ghana. In Ghana, multisectoral and interdisciplinary coordination to prevent and manage issues related to public health have been present for about 20 years without being directly attached to the One Health discourse. In the academic literature, there is evidence of interdisciplinary research that address topics at the environment-household health nexus. Other research look at the hazards posed by urban agriculture to public health, and other works look at the cost-benefit estimation of preventing zoonotic disease. In Ghana, the commitment to the international health regulations and the global health security agenda foster fundamental changes in public health management. As part of this process, the One Health approach gained attention to tackle the challenges faced by the health sectors by pursuing a comprehensive strategy for health. The research objectives of this work are two. Objective number 1 looks at the issues that, despite the long way that transdisciplinary and multisectoral collaborations in the health sector have followed in Ghana, the evidence on the benefits of integrating health actors under the One Health approach is unclear, due to the fact that the majority of the efforts in the matter have been done in isolation. Building on the existing scholarship in policy and developments for shaping multisectoral collaborations, this work has the objective to analyze the evolution of multisectoral collaborations in Ghana to determine the extent to which those align with the present conceptualization and priorities of health. The second objective relates more to the use of One Health as a policy instrument, which is being influenced by a broad range of factors that recognize the opportunity to reform the way in which multisectoral collaborations occur. However, the drafting and implementation of a One Health policy goes beyond the promotion of multisectoral collaborations and implies a process that might generate concerns and resistance to change from different stakeholders. So the objective is to situate the One Health approach in the prevailing political structures. As for data and methodology, on the one hand, a literature review was conducted to find multisectoral initiatives between environmental health, animal health, and human health sectors in Ghana, with the purpose of assessing the development and understanding of the One Health approach. Here, the PRISMA guidelines were followed and 49 records were analyzed and the information extracted categorized by 1. The narratives behind multisectoral collaborations, 2. The disciplines associated to those, and 3. The linkages between health systems. On the other hand, related to the One Health as policy instrument, an extended review of literature reports and policy documents, including laws and regulations, was conducted. Primary data was obtained from interviews with experts. The data was analyzed following a political economy framework, as shown in Figure 1, that allowed for identification of stakeholders, the roles and perceptions regarding the policy development process, the payoffs from adopting the One Health approach, the resources available to adopt the One Health approach, the collective action capacities, the aggregation of preferences, and the challenges to the policy development. The information retrieved from policy reports, evaluations, and action plans refer to One Health as an approach that prompts collaboration between health practitioners to develop systems for surveillance and response to public health emergencies, and was strongly influenced by the priorities of the international health regulations and the health security agenda. If you look at Figure 2, it shows the different international donors, government agencies, ministries, research institutions, and practitioners involved in the One Health policy development in Ghana. They are categorized by color. The second key finding is that some components absent were related to local understanding of disease ecologies, land use changes, population growth, access to primary health care, and health information exchange. It is important to note that many of the non-mobilized stakeholders are actually agencies working in those areas. As for the recommendations, we can say that the inconsistencies found are opening opportunities for the One Health in Ghana to expand to sectors that have not been accounted for. For the One Health as policy instrument, it is recommended to make a continuous systematic analysis of the stakeholders' interests and implications, to fill the gap in knowledge regarding the economic implications of reducing health risk and promoting environmental conservation, and to advocate for the involvement of institutions relevant for the policy implementation process which are not mobilized. I will invite you to follow my research, and thank you very much for your attention.